again. So now that's the first, some people now that first stage. Now you go see say, okay, if you now notice say this person don't get depression, is getting depressed. Now depression no be just one day, say the person no happy one day, now be depression. No be like the one way say, they depressed because I don't get money for pocket. Now something, before we go say this person they depressed, it go be like 2 weeks, we don't notice this ups and downs. There are a lot of things, other symptoms. You know, they eat or they eat too much. Like on the extreme side, either the person know they sleep well or they sleep too much. You understand? So there are other things clinically we can say, okay, this is why we can say, okay, this is depression. And it must not reach like 2 weeks. This thing they happen. So no, we just say now one day we can't assume say now what
like waiting one person been talk once at a time. Say if you go party, you see say now the person now in the ginger pass for the party. So may you look the person well. Like say that person they pass through.
They use and take pass. Some
so
people
just want to use that.
Yes, some they use and take cope with life. Make I just go. Now me go happy pass. Even when you see them, some they smile.
Because I don't hear one story like that. After the party, the person don't ginger. Now it be the life of the party after the gingering and everything. The next day the person commits suicide.
It they happen. It they very possible.
So now that kind of person now, you know, go feel now just like you now we be say now professional you be now. Now you go feel talk say, oh, this kind of person. So now you go they look and say, like say this person they pass through depression and all that.
Okay. Sometimes you know say if you just they look and like that, no be like that. You understand me? Now people where they close to them, whether in a way or one way or the other, you don't get statement when you don't make it before. You understand me? We will not be like some people. You get one of my gang go talk say we no be babalawo where they know everything. If you not talk, we no go know. Now people where they around and where they close to them, before now in they behave like this, in they act like this, you can notice say how all of a sudden this person don't they act strange. You know they act like this before. You understand me? From there, you notice that things don't change about them. Now you go closer. I remember one client very recently, somebody when they talk about. He just all of a sudden, one die. Sure. You understand me? So this kind of thing now, people where they close first notice them. When you notice and say this thing they happen, then with that you can now point finger to the fact that in there they say and say you just want to be happy, they happy. Meanwhile, some other things when they do before they like to do more. But if find yourself in that situation, now make I just jump, forget my problem.
And that one now they see they lead some people where they say they will come they addicted to drugs.
Yes. All these things get root when they take point fingers when the points go. Some of them go say make I take substance, take calm down, make I drink alcohol, take forget the problem. But that's actually the wrong way because taking the alcohol will not solve the problem. When it clear your eye, you go back to that problem. So we will only advise, let's focus on the solution. This is the solution. This is the problem. Yes. And we always tell you, things you cannot change. Throw away that thing.
Well, you know, say they
just change. There. A lot of things, so I know if you change if I start from Nigeria.
Yes.
You understand me? Now, throw away that one. No matter how I do, I'm a Nigerian. I feel really change the fact say I feel better my life inside this country.
Nigeria.
So make I focus on the solution. How I feel take better myself inside Nigeria. What I focus on. You understand me? So now that one another first stage where we say some people feel find themselves inside. Another first few months. Maybe they don't tell you say you get this problem, you get HIV, or you get diabetes, or you get BP issue. You understand? That's first time. If first they tell yourself, say no. The next time you come, they say, let's say reality setting. Few months later, you come, they say, for real, say this thing they do me. And they see this symptom, and they see this one. Now, before you know to cope with that life, you come before you know depression go set in, anxiety go set in. You understand? Now, some of them are this chronic phase. Especially when you talk about somebody with HIV, all this diabetes, this chronic state is more like that phase. I don't they take medications. This medication gets side effect. You get the way they do me for body. Now the anxiety, the whole thing will just make you begin to worry yourself, excessive worry,
and go even affect the person itself. The medication itself not go even work.
Yes, that one another thing, another story. Entirely because you get waiting this depression, anxiety they do we go make person no go feel addict to medications. You understand? So now at that stage, the person just say, this thing they disturb me. How go they take medicine every day? e no easy now. Even malaria drugs, some people no dey fit finish am.
Like for the HIV drugs now, where they say na till lifetime.
Till lifetime, you know.
Until when they announce say the cure
don come, because you no even dey sure of when e go stop am. The same thing like diabetes. No be the same thing.
Na still the same thing.
The same thing with somebody wey get BP. Yeah, they don take am say this one, as e just dey take the drugs to be fine, to manage the
just
situation.
manage body.
Thank you. And these drugs no be say na I take am once in a week. You take am every day. So all those things now go be like reality dawn on you, like na me go dey do this kind thing.
You
understand?
Choice.
Yeah, so some people na that time then they face depression and anxiety. Why some people na the transition state. Now this stage na when, okay, they don dey live with this thing, but my lifestyle need to change now. No be everything I go do as usual. Now, for example, make I say I dey find job. I can't go there and they wan do medical test, and then they say if I get this thing, I no go get am. It's been like there's some of the job I no go near there.
Yes, now the person go just
shift back. Now, and the kind difference wey they make, the disclosure, how I wan take tell them.
And again, maybe
relationships.
Maybe when the person dey healing time, and you go on, they won't say you want talk about HIV, and you can't see the reaction.
The reaction of people.
Those
thank
people
you.
Go do it, you go shift back.
So that phase is more like you dey ask yourself how I wan take do am, because that one alone go give you depression. That one go move you enter anxiety. You understand? So now just this stage, so everybody only they come the same time. You know, be say if you tell me today my own must come. Yeah. So it depends on how the person they go. And the support, I no go forget to always talk about support. The support anybody gets at this point in time, now it go help am scale through.
But until the person speak up before if he gets support.
Yes, now we can talk say.
If you don't speak up now, we have support. What take off?
See, now I won't speak up. If I dey speak up to the right person, like if you remember the last episode where I do, where I talk about a client where we say at first it was hard for him. He say if I tell my papa, how he go feel. You understand? Now it take him time, but when he tell him father, when the father give him support, he became better. In fact, he even want to talk about it anyway. You understand? So all these things still boil down to the fact say somebody if you no get mental health issues, if he get support. Even person wey get diabetes, if he get mental health issue, when he no get support, even financial support fit make us get depression. Because
that one day generally now.
Because,
that one day.
Because by the time why I dey as Nigeria happen, if Nigeria happen to you, in quote, my sister,
that one the depression don't dey.
It don't dey. So now be the thing. So now waiting they
Thank you very much, ma. So this one then I want to ask you this question, because based on waiting we dey talk about, when you talk about depression, still female person no fit
taking
medication and all that. So I go like make you still break am down well, so that our people where they hear our voice, they go do it and they go understand. So this one go lead me to this question: in what ways do depression and toxic affect HIV treatment adherence and overall health outcome? So now not be only even HIV,
yeah.
Now with overall health outcome.
Okay, thank you. Now, if we want to talk about not just HIV, and we are still trying to look at it generally, now reduce motivation. Somebody will get depression, definitely. The zeal, the like to do what they do on a norm, and one of the things like go get mind to do. Maybe like to go out, to go talk with people. You don't want to talk to anybody. You just want to lock yourself inside house one day. So that motivation will reduce. Now, when you get to that point, it means say if you get medication to take, me sometimes I dey ask some of my clients, if you no hungry you to chop food because something dey vex you, you know they happy, you go want take medication. You know want take am now. You know they possible. You understand me? So now when you know say body sweet you, are they okay? Yes. Then they will take am. And that thing fit lead to forgetfulness. Like you go dey forget. Now one thing about wetin this depression and anxiety they do, it go make you sometimes you even forget some things. But for you to think that you dey waka for road, your mind no dey where you dey go. You only dey think. You don't even know wetin dey happen, because wetin you just dey think now as you dey go, you just dey think about the number of persons wey hate you, and the way Buhari or whoever wey be this thing dey kill you. Meanwhile, they don't know you. They don't even know your father house. But this is what is coming to your head. So you know they remember any good thing, not just the negative ones. Now, negative belief. it has a lot to play on our thinking. See depression, see as mental health issues, it has a lot. They play with our brain well, because you have a lot of negative belief. Now when you come believe say this medicine wey they take now they kill you, meanwhile now they help you, you go take am. You don't go take am now. So now what it be? So you have a lot of negative belief when it comes to that. Then isolation, social isolation. You don't already tell yourself, say, where on a norm, if to say, if I tell you, say, see my problem, so that you go feel help me. Now, I know say, if I tell you I dey fear, whether you go reject me. Now I decide to isolate myself. I won't take that because you feel they help me say, you don't take your drugs today. You understand me? You know, even person, you know, they remember, person no remind you.
When person never come out from depression,
out, you know,
how you want to get treatment partner?
So naive. So you understand? So this thing feel lead to that. You know, go take your medication because nobody self to remind you. You just isolate yourself.
Because now only you just know.
You understand the head. So this is what you can do. And you get another way they play on your head. Maybe say they tell yourself, say, the effect of medication when they much, they make can look big for you. They say this thing, maybe at that time, you get some people who come say, as I did like this, since I begin taking this medication, belle they pain me, not being cause belle pain. Maybe you suppose the one, now the one. You understand me? He says, since I begin to come, this my leg, they numb. I know they feel work out well. Meanwhile, you hit your leg for somewhere, you forget to say you hit your leg for somewhere. Now, all these things, anything will happen to you. If you cough that time, you go say, now this thing happened to me. The same way when we look something, we say, now my village people. you pass, maybe they walk out for road though. They won't carry stone. Somebody wants stone something, mistakenly hit you. Say, my village people I follow come. Then find me come here. You understand me? So now the same way, this whole thing will play for our head. But like I said before, I will continue to the announcer. You see, this awareness is very important because when we know about mental health, we go help people who are around us. A lot of people don't die today.
And because
people don't support them. Some go say, hey, you been talk You know, say you just come meet, you get some kind of friends so you go meet and say, as I did like this, I don't tire. I won't die. They go say, die now, you be the first.
Not be the first person.
Not be the first person.
The person they speak.
You know, say the person they talk from at talk again, say, not be the first now. Be they look for what I go use help you die. Now we joke. When it come up, say, hey, in talk So those little words that comes out of people, whether we they reason the thing, say this thing feel be joke or seriousness, we should work on it.
When I still notice, we say, or maybe if it still be the cause of why people know they like speak out. Now because of say. They say, you know, they know person finish until when you don't tell them your problem. So you even your own family member, your father, your mother, still deny you at the die minute.
For sure.
Now until when you don't talk out waiting in your mind, finish first before you go really know whether this person will really support you or not. So I believe say maybe now one of those things where they make a lot of people they feel like say they no want talk, say make I keep on to myself. And for this mental health, like for the clinical mental health psychology, I believe say you know they're everywhere.
That's the awareness. The awareness. That's the thing. Although we don't, if we talk about, because if you now won't go down to people where some people already feel say if they talk about mental health, we talk about mad people. Now that's one big problem too, because we just feel say this, if I know they mad though, meanwhile you're going through a lot. You understand me? A lot that is enough to even make you mad, but you feel using the head. I know they mad though. I beg, no talk about that one. Now we get people out there, but we just have few of them. Not be everybody. So even the few where we get, the question is that have we used that few to achieve our dreams? No. Now just people they try to come out. Normal, even schools and all that, they're supposed to have these people in place.
You
understand? Organizations supposed to get them in place because people should talk. See a counselor. When I say a psychologist, a clinical psychologist,
don't be just ordinary counselor.
No, so that when you talk, they understand you and they see how to help you out. You understand? So if you want to talk about this one, it's very broad. So I know we won't go there now because there's a lot that if you're saying the ways that people, apart from the awareness, that people should know that, okay, this is existing and how to use it. I remember when I even, like earlier, some years back, someone was like, now I pay my people finish now to come pay psychologist. So you see the mentality. But when we know say this thing, they very important. No say if we put them here, then free help. Even the work, because you get some part of psychology, they tell you say this work, this person feed one. You get the test, then go run mental test, then go run for the person. They say this person fits the person to the job.
Or not.
You understand me? So what if I not fit do that job? You can't carry and give me, they expect 100% from me. You understand? So now the problem. It can affect the person, it can affect the job too. So now waiting day. So that one, like I talk, now very broad topic on its own.
So our lovely viewer, so we will find time when we say we go do it, we will discuss about that one. Thank you very much.
Thank you, ma.
I beg, wait till you get to tell our don't get viewers where they view us.
Oh, my viewers, I like the fact that every time I sit down, they listen to us. Now do well. I go still stand on waiting I stand. Like I said before, it's necessary that we create this awareness. You have somebody around you that you feel needs help. Please don't keep quiet. And not when somebody says something, we mock that person. No. The same way, like I always say, life no complete for anybody. Yeah. So, like a song where and talk say, this life, no complete. Say, we complete for, no complete for everybody. So the way should they pain you, maybe person in a hand they pain them. So, not when the person come to you, please help out. Do that little thing. You might not help with money, but only a word out to that person. Or even looking for someone to help that person out. Maybe a psychologist. I think it will go a long way to help us reduce the rate at which people suffer from this mental illness. Thank you very much.
So I go still want to make you still talk to anybody out there where they listen to our voice, where they pass through any depression. Because I know say a lot of people, they pass through depression but they know they like speak out.
Yeah.
So what do you go like tell our viewers where they say that they watch us and they listen to us now? When I know say 1 or 2 persons feel they pass through depression.
Okay. Now, thank you. If I don't know if you get a particular story where they say the man, I don't want quote because we know they talk about religion here. The man, he no get eye, but he get mouth. Now, that's your mouth, now your power. Wetin you talk, na im go help you. If you keep quiet, like I talked before, we no be babalawo. Now when you come out, come talk. I know say you get this fear of talking, but talk to somebody, a professional. You dey see the link as you dey see the video. You can chat and say, oh, I want to talk to somebody. We can help out. You understand? So don't keep quiet. Inside that your small place where you dey, no keep quiet. Online, I think so online too, there's still some people that can even help. Yeah. If you chat, maybe you check all those therapies online, they can help out. First of all, come seek for the help. No fear for money, because not everybody they collect money. At least make you save life first. So please speak out. That is the power you have now to speak so that they will help you. Thank you.
Thank you very much, ma. Our viewers, our beautiful viewers, and I don't hear, I beg, speak out. Depression no be better thing. It lead to so many things, like for person to go do it, to go by himself. I beg. And our brothers, our sister, our husband, our wife, anybody where they hear our voice, no say because person can't tell you, say, see what they pass through. Apart from the HIV, because I don't say, once when I hear HIV, na big thing. Why HIV don't be big thing, na small thing. So, no can say, person tell me this. Apart from HIV, any other thing, you can't announce the person, or you discourage the person, or now you can't be the person we won't even lead to the person to impie state. I beg. Make we love each other, embrace each other, share story, and so that we will feel live long. Thank you very much. I hope say una enjoy this our program. We go see una on our next episode. Stay tuned. Bye-bye. I remain Ibitola Esther Ogechi.
HIV and Cancer Initiative. Sachi. Sisters Against HIV and Cancer Initiative. Sachi.